Good morning, everyone. My name is Yusuke Endo from the Northwell. I work as a research scientist in Dr. Becker's laboratory. Please excuse me, my English is not perfect, so I will do my best. I don't have any disclosure. First, post-resuscitation with cardiac dysfunction, PRMD, result from the acute cardiac injury caused by the cardiac arrest and has been reported to occur in the 45% of the cardiac arrest patients with a cardiac associated with poor prognosis cardiac arrest patients. And PRMD is characterized by the impaired cardiac output, ventricular dysfunction, and hypertension. As shown in this graph, during the acute phase after resuscitation, decrease in the ejection fraction and increase in the myocardial performance index observed, indicating a deterioration in the cardiac function. Mitochondrial dysfunction is thought to contribute significantly to the development of the PRMD and circulatory shock from cardiac arrest. However, currently treatment for the PRMD preliminarily rely on the vascular and mechanical circulatory support, which are not curative and do not target the underlying disorders of cellular identity metabolism. So mitochondrial transplantation is a therapeutic strategy that restore mitochondrial function by fascinating the fusion of the exogenous mitochondria with endogenous mitochondria. As previously mentioned, vascular and mechanical circulatory support are not direct treatment for PRMD, as they do not address the underlying pathophysiology. In contrast, mitochondrial transplantation offers a direct therapeutic approach by targeting the mitochondrial dysfunction, which is recognized as a central pathophysiological mechanism of PRMD. So this study investigated whether intravenous administration of the MTX immediately after the birth can improve hemodynamics function and attenuate PRMD without relying on the conventional treatment. So in this study, 60 pigs weighing 30 kilograms were administered potassium chloride intravenously to induce the ventricular fibrillation and 8 minutes of the cardiac arrest. So mechanical chest compression and defibrillation and adrenaline were then administered according to the guideline-based CPR protocol. So immediately after the birth, animals will receive the intravenous infusion of either resuscitation buffer in the vehicle group or isolated mitochondria in the MTX group. The animals were subsequently observed for 240 minutes, after which tissue samples were collected for pathological examination. So in this study, no vasoactive agent were administered post-resuscitation, allowing for a direct assessment of the effect of the mitochondrial transplantation on the post-resuscitation myocardial dysfunction. So in this study, mitochondria were isolated from the healthy pigs and used for allogeneic transplantation. Specifically, 10 6 millimeter pieces of skeletal muscle tissue were collected from the donor pigs, homogenized and filtered and in the ice-cold buffer, followed by the centrifugation. The resulting mitochondrial pellet was resuscitated in the 5 ml of cold resuscitation buffer and prepared for injection. For group allocation, animals that achieved successful resuscitation from the cardiac arrest were randomized in the 2 treatment groups. One is the big group and the other one is the MTX group. Each group receives the respective treatment, either resuscitation buffer or mitochondrial transplantation, administered once and immediately after the birth following the cardiac arrest. To evaluate hemodynamics, we utilize the transplant dilation method, which is well established in the pig models. Briefly, this technique involves injected cold physical saline in the right atrium. And the sensor placed in the femoral artery detects the change in the blood temperature, generating the thermodilation curve. And in this study, we measure the cardiac output and systemic vascular resistance, and DPMX as an indicator of left ventricular contractility, and cardiac power output as a measure of the cardiac energy output. This photo shows the experiment in the progress. The tips on the right is a recipient with a hemodynamic monitor and a mechanical chest contraction device in place, and preparation for the CPR underway. The tip on the left is a donor. After inducing the general anesthesia, the surgical procedure was immediately performed to harvest mitochondria from the skeletal muscle. By conducting the experiment with two pigs simultaneously, so we were able to administer freshly isolated mitochondria to the recipient. In each group, blue represents a vehicle group, and red represents an MTX group. In this model, so blood pressure decreased after resuscitation, accompanied by reduction in the cardiac output and left ventricular contractility. However, mitochondrial transplantation significantly improved the parameters, indicating that the decline in the cardiac function following the resuscitation was attenuated. In this model, a significant decrease in systemic vascular resistance was observed after resuscitation. MTX appeared to suppress post-resuscitation vasodilation, thereby contributing to the maintenance of the blood pressure. Additionally, improvement in the cardiac power output indicated enhanced overall cardiac energy output. The significant increase in central venous oxygen saturation further suggests that MTX not only improves the cardiac pump function, but also enhances the balance between the oxygen supply and the demand by mitigating the post-resuscitation vasodilation. This slide shows a pathological examination result from the myocardium. The left panel represents a control group without cardiac arrest. The middle panel shows a vehicle group, and the right panel shows the MTX group. In the vehicle group, so extensive myocardial cell necrosis was observed within the area outlined in yellow. In contrast, the MTX group exhibited a clear reduction in the myocardial cell necrosis. This slide shows the result of the pathological examination of the brain in the same models. The yellow area indicated ischemia change, specifically acute necrosis in each region. Notably, reduction in acute necrosis cells was observed in the hippocampus and the cerebral cortex following the mitochondrial transplantation. In the lungs, the extent of alveolar hemorrhage was evaluated in the liver, and the extent of hepatocyte necrosis, and the kidney, and the degree of tubular epithelial cells necrosis. So, as shown in this figure, MTX demonstrated a tendency to reduce this pathological change. So, result of damage in each of the 5 organs and the 7 regions was evaluated by pathological and blinded condition. Since cardiac arrest is a systemic ischemic perfusion injury, the score for all these regions was summed to create multi-organ score, which was then compared across the 3 groups. In the vehicle group, there was a significant increase in systemic organ damage compared to the control group. In contrast, in the MTX group, there was a clear reduction. Sorry, this last slide is a summary. I'm sorry. Thank you very much.